conversation that would often come up in my work, particularly in hospice and palliative care, especially when it was with a patient who was very alert and they knew that they were terminal, was the topic of what happens after death. Now, I am doing a video on why I believe there's more to life after death than just nothing. But I want to talk about kind of these conversations and how I handled them before in the past, and and they ended up being more helpful to the person, particularly a person who was not unsure of what happened after death. So let's talk about that today. Hi, my name is Abigail. I'm here to normalize these conversations and education about death and dying so we die better at end of life. Let's get into it today. One of the, just such a common topic that comes in when you're talking to patients that are terminal is the topic of, my gosh, what happens after we die? And I am very clear, that we, at least I, don't have 100% assurance as to what happens after we die. Many people with whom I spoke might have, certain religious or other spiritual faiths that they adhere to, and that gives them comfort as to what happens after they die. But I want to talk about these cases where I was talking to some patients where they really weren't sure. So let's kind of delve into that, and then how I maneuvered these types of conversations and dialogues. Many times when, talking to a patient who was pondering and kind of thinking about what happens after we die, the first thing I would ask them is, so what do you think? What do you think happens after we die? Many times they would, revert to what their religious practices told them. And it was really interesting because what naturally happens at this time of life is people are really reflecting on not only how they live their lives, but especially what's going to happen to them after they die. Very natural, very normal things to feel. And I want to remind you that if you are feeling fear around this, it is very normal, it's very healthy, because for us, the unknown is a daunting type of thing. And it's natural and normal to be fearful, especially around death. Okay, so let's first acknowledge and normalize this, first and foremost. But let's also process this. Let's ensure that we learn how to process these feelings in a healthful way. I always want to recommend, I'm not a therapist, I want to be clear there, but I always want to recommend that if you haven't already, that you do enlist the assistance of some type of licensed professional that can help you cope with your feelings correctly, because everyone is individual, and we really want to make sure that you get the individual attention that you need to process your feelings and fear of other feelings so that you can have a really peaceful death. So let's get back to it. In these conversations, so I would ask them, what do you think happens after you die? And, again, they may talk about their religious stuff, and, then we would, of course, at that point, use the counselors that we had on our team to really speak to those specific things. Again, I'm not a therapist or a counselor, I'm a registered nurse. And, and especially in hospice and palliative care, you have these incredible, really incredible, trained professionals in social work as well as spiritual care counseling. And, I want to be clear that in hospice and palliative care, which is another reason why you want to have it, they never try to tell you to think a certain thing or, prescribe a certain thing in terms of a religion or things like that. They're really there to deliver individualized care. So if your religion is nature, they're going to talk to you about that and going to work with you on that. If your religion is some other type of religion, they're going to talk to you about that. Okay? So let's get back to the conversation. So when I was having these conversations, yes, we would then tailor the conversations to their particular religion, if they had one, or certain spiritual practice that they had when we do that. Many times, a patient would look at me and say, I don't know. And I don't know if I really believe this religion that's telling me that I'm going this way or that way. I just really don't know. And then you have someone saying, okay, so what happens after I die if I don't know? What happens after I die? And, at first when I was ever asked that question, I kind of thought, oh my gosh, what do I do? I don't even know what to say. So, this actually came from one of my VPs, one of who's very close to me, and a person who taught me a lot about hospice and palliative care, especially when I became a director. So the question was, well, then my response would be then, what would you like to see happen after you die? What would you like for it to look like? And while we want to make sure we always acknowledge the fear, acknowledge the other reasons, of fear for other emotions, anxiety, things like that around it, let's make sure we first acknowledge and normalize all those feelings and do the therapeutic communication, especially with the trained counselors on the hospice team. But then also talk about what would you like for it to look like. And this is where I really want you to think about, what would you like for it to look like? What would you like for it to happen the second you die? What would you like to see? Would you like to see a bunch of colors and lights? Would you like to see a loved one, a pet that have already died? Would you like to see them come? Would you like to see a beautiful garden? Would you like to see whatever it is, a great rock concert, whatever it is, as you're passing through to the death experience? What would you like to see? And then make it a habit, consistent practice, especially for the person who was, terminal, to when they started to fear death, to acknowledge the fear first and foremost. You never want to pretend that it's not there. You never want to try to get rid of it and move on quickly. That's not realistic, because if you're having these feelings is normal and healthy. Acknowledge it, and then you want to think about, well, what would I like for it to look like, and spend some time thinking about that. Using your hospice team is going to be very valuable here, because they're trained and they can go into other types of things and talk to you about your spiritual distress and other things like that may be a part of this process for you. So again, another reason why it's important to have hospice, because we're not just physical beings, right? We've got other components to ourselves that need equal attention in order to ensure we have the death that we want, okay? And in this process, there's a lot of healing that happens too. So I wanted to leave it at that. Give it some thought. Let me know if you have questions. Let me know if you have a specific thing that you'd like to see when you die. I'd love to hear what you have to think. All right, I'll talk to you soon. My name is Abigail, here to normalize these conversations and education about death and dying so we die better at end of life. I'll talk to you soon. Take care.